Record on computer. Okay.
It shows that you're recording. I don't know if I'm recording.
All
But we'll
right.
see.
Well, either way, it's being recorded and I can send it out. So sorry to make you start over.
No, it's perfectly fine. Okay, so I'm going to quickly just go over the components of the Vascade, starting from distal end to proximal end. We have the disc, which is made of nitinol and covered in a polyurethane coating. From there, we have the locking sleeve that protects the collagen that is wrapped on the core wire. And you can see that the collagen goes all the way to this small white marker, okay? Now at the end of this locking sleeve, you'll see is a wider white marker, which is just what we call the lock. Now to unlock this locking sleeve, all you have to do is just take this key, put it into the lock, grab the lock, and slide the sleeve back, okay? And we put it back for now. And then back on the end, we have the silver handle, which you do most of the holding of the device with, and a black actuator. When you pull the two apart, you should feel a click, like a detent, and then it should come back, and then you have a green marker right here indicating that the disc is open, because of course, once it's inside the body, there's no other way to know that the disc is open. So again, 2 hands to open it, and only 1 hand to close it, okay? So when I go in, I want to flush the sheath, and I want to, after testing that the disc is good, I just want to dip the end of my device in saline just to activate the collagen, okay? Just for a second, just go dip, and then you're ready to go in. So when I go in, I want to hold it kind of like a pencil. I want to be towards the tip, and I just want to go with short strokes, go in through the sheath, up to the lock, or to the middle of the lock, it's up to you. At this point, if I can get this down a little bit, at this point, this is where we want to open our disc. The disc is what's going to give us that temporary hemostasis when we come out with the sheath, because otherwise you'd be bleeding all over the place. So you can see right here that the green is present, so that tells me that the disc is open. At this point, I'm just going to grab the sheath and start coming back until I see the device. I can use my left hand, grab the device, and ride the sheath all the way off the end of the device. Now the sheath is gone, so the only thing keeping me from bleeding is that disc. So I now want to grab, if I want to come back some more, there we go. So I now want to be holding the device with my right hand by the silver handle. And I want to come all the way back up against the arteriotomy until I see that the blood is stopped. That tells me there that, that we're up against that arteriotomy whenever the bleeding stops. If you don't see any bleeding stop, get someone to hold, and then you also want to grab, or if you're not sure you're up against the arteriotomy, you can grab a clip that comes with each device and just kind of hold it in place with this clip, and then you can put the patient under fluoroscopy and compare it to where you had the groin shot that you took previously. And again, you don't want to do this in a high, like in a situation where you think it's a high stick. So you do want to check under fluoro. So that's just what I did right there. So if you think that you're up against the arteriotomy and evidence shows that you're up against it, this is when you want to expose the collagen that's right here on top of the artery, okay? So by doing this, like I showed you before, all you want to do is bring the key into the lock, grab the lock, and pull that sleeve back. Now this point is where we call the dwell time. This is going to be like 30 seconds so that the collagen can take the blood that's in the tissue tract and swell, okay? So we wait 30 seconds. Once that 30 seconds is over, what we do is we get our hand, we get ready to hold arterial pressure, relax the tension, and then just close it like we did before with just one hand, and then come out. So hold it for 5 minutes or until you get hemostasis, and you should be okay. The only major contraindication is bovine derivatives allergies, because it is a bovine collagen. And that's really all there is to it.
Does anyone have any questions?
Laura, any difference for arterial versus venous?
Well, venous, you would only hold for 2 minutes. And if I were doing venous, and this is how we show with the folks with MVP, because veins are a good bit thinner than arteries. We just use a little bit more caution when we're coming out with the sheath. What we do is just kind of work it over the sleeve so it doesn't grab too hard on the device when everything comes out.
Rob Joe, just so you know, I'm down in the reading room.
And then it comes out, you know, a little bit less aggressively. And then we do the same thing as you would for the artery. 30 seconds. After 30 seconds, relax, pin cap, and we're out. Did I go?
Any issues if people are too big or too skinny?
The only issue I would say with people who are maybe too skinny is you may see a little bit of the proximal edge of the collagen sticking out of the body. If you do see that, all you would do is just take the other end where that black actuator is and just kind of push it back into the tissue tract. And again, it's still sterile, so it works perfectly. Large people, it might be a little more difficult to know that you have enough of the device sticking out because you don't know exactly how deep that tissue tract is. So you may, in that instance, you may want to definitely use the clip and compare your femorogram with the 2 markers that are on this disc. Whenever you see that those 2 markers are going to be a lot closer than here. Let's see if I can put it in front of the camera a little bit better. See, there's one it's like a bead and then another bead, which are both you can see easily under fluoroscopy. It should just match where your insertion site is.
Great, thank you.
What have you found to be the most common point of device deployment failure?
I would say probably skipping a step. I've seen mostly with veins because we do a lot of MVP launches. So with veins, I see a lot of pull through, which is just basically pulling the disc through a very thin vein. But with arteries, I don't see a lot of failure.
Is there a caliber size cutoff you can use the device for?
Yes. So just like with minks, there's a 5 French and then there's a 6-7 French, and we don't suggest going over 7 French arterial.
Sorry, I mean like diameter of the artery.
Yeah, you want it to be at least twice the size of the sheath. Same with most closure devices.
What about reaccessing a site that you previously closed with the Vascade? Can you go back? How soon can you go back in on like a right side there?
So again, it's collagen, so it will reabsorb, but you got to give it 30 days, or I would go above or below. And again, you can go for Vascade. If you want to, close again with the Vascade, you can go below the bifurcation. You can be at the bifurcation. And again, calcium, because it's not a bubble, you can deploy this at the site of calcium. This can take quite a bit. It can be pulled up against rock, unlike other devices.
Do you guys have any other questions?
Sometimes we've had issues, I've noticed, when then sometimes it's difficult to get the lock to come back, like to get the white or the silver to come back. What do you recommend if we're having issues getting the
That's a
actual
very
to
good
expose
question.
the grain?
That's a very good question. Let me see, can you all see that? So in that
Move
situation,
your, okay, yeah, you can see it.
are you able to see it okay? So in that situation, right, you've got the sheath out, right? And you're up against the arteriotomy and you're seeing that you're coming in and then this is not coming back. It's getting a little stuck, is what you're saying. If it gets a little sticky like that, I would drop my right hand from the silver handle to just above where the key is into the lock. And at that point, you have more leverage, and then I would just bring it up that way. And I've seen that work almost every time.
Do you want to tell them about the flushing?
Yeah, so, and again, sometimes if your hands aren't perfectly clean, sometimes you can get a little bit of gunk into the locking mechanism, as well as where the sleeve comes back. So if you run into a situation where, again, you've inserted the key into the lock, sometimes the key isn't all the way inserted. So you just come back, put it all the way in, make sure you're burying that blue. And if that still doesn't work, it's still not coming back, and you've dropped down here and you're still not coming back and you don't want to pull through, I've seen where in live cases where if you take like a syringe of saline, doesn't have to be heparinized, and just actually insert some saline into the tissue tract and maybe a little bit into the lock itself, just to make sure it's nice and clean. I've seen that work quite often as well. But again, that doesn't happen often. And it's certainly, if it feels like you're pulling too hard and it's not coming back, usually in most cases, if you just drop down to right above the lock, that'll give you the leverage you need to move that sleeve back.
I know you guys have cases starting soon, so any other questions? We can certainly I'll send this out, and I can send out some of our studies if people want them. I'm trying to think, that's really it. It's simple, it's easy to use, and we thank you guys for your support, because you're a good customer of ours, so thank you, we appreciate it. Any other questions, comments, concerns?
I can go over the steps again if you'd like.
Okay.
Thank you so much.
Thank you guys so much.
Have a
Thank
nice
you,
day.
guys.
All right, Yolanda, let me
Thanks.
know if you want it. We can set up another one if we need to down the road, but I think this was good, so thank you.
Thank you so much. I'm glad we recorded it so that way we can make it accessible to everyone
Yes,
else.
I will send it out. I'll figure out how to do that.
Okay.
All
Thank
right,
you.
awesome. Thank you guys. Have a great day. Stay safe.
Thanks a lot, everyone.
Thank you. Bye-bye.
Bye.